Hey there! If you have a colonoscopy coming up, you are in exactly the right place. In this explainer, I'm going to walk you through everything you need to know, step by step, to make your preparation as smooth and as effective as it can possibly be.
So, let's be real for a second. The prep can seem way more intimidating than the procedure itself. I totally get it. But I want you to know the process has gotten so much more patient-friendly over the years. By the time we're done here, you're going to feel totally confident and ready to go.
So let's just break it all down. We're going to walk through 5 key stages of your journey. We'll start with why a good prep is so darn important, and we'll take it all the way through to your recovery.
Okay, first things first. Let's tackle the biggest question. Why do you have to go through all this effort? Well, it all comes down to one simple thing: giving your doctor the clearest possible view of your colon.
I mean, this slide just shows it all, doesn't it? It's night and day. On the left, if the prep isn't great, our view is blocked. We could easily miss something small, like a polyp. But on the right, that's the goal. A crystal clear view so we can do a thorough, accurate exam and find anything that needs to be found.
So when we say an adequate prep, it's about more than just checking a box. It means the procedure was truly valuable. It allows us to say with confidence, okay, you're good for another 10 years, or whatever your specific follow-up plan needs to be.
And this right here, this is the standard of care we're all shooting for. Top quality centers want more than 90% of their patients to have an adequate prep. Your effort at home directly helps us hit that mark. And more importantly, it ensures you get the best possible outcome for your own health.
Okay, now let's talk about what you can eat. Believe it or not, your journey to a clear colon actually starts in your kitchen a few days before you even think about drinking the prep solution.
It's really a simple, gradual change. A few days out, you'll start on a low-residue diet. That just means avoiding things with a lot of fiber, like seeds, nuts, corn, and raw veggies. Then the day before is all about clear liquids. Things like broth, clear juice, water, you get the idea. It gives your system a huge head start.
And check this out. This is fantastic news based on the newest guidelines. You do not have to be thirsty and hungry for hours on end. You can actually drink clear liquids, especially ones with some carbs, right up until 2 hours before your procedure, and makes a huge difference in how comfortable you are.
All right, now for the main event, the part everyone always asks about, the prep solution. And the good news is we are way past the days of those giant gallon jug preps. Things are much better now. Today, the absolute gold standard is what we call a split-dose regimen. You drink half the night before and the other half the morning of the procedure. Not only is this way easier to tolerate, but it's actually proven to do a better job cleaning out the colon. It's a win-win.
And the news keeps getting better. For most people, we now recommend these lower-volume 2-liter preps instead of the old 4-liter ones. They work just as well and, let's be honest, they make for a much, much better experience for you.
I mean, this number just says it all, doesn't it? Patient satisfaction is a huge deal. When you see that over 90% of people are willing to do the low-volume prep again, you know we've found a method that really works for people.
So, what does this actually look like? Well, here's a quick example. If you had a 10 a.m. procedure, you drink your first dose the evening before, set an alarm for the second dose early in the morning, and just make sure you're done with all liquids at least 2 hours before you're due to arrive.
So you've done all the hard work at home. Awesome. Now let's talk about what happens when you get to the clinic. From here on out, our focus is 100% on your comfort and your safety.
To make sure you have a comfortable, totally pain-free experience, we use procedural sedation. And as you can see from this big European survey, there are really well-established, super safe methods that are used all over the world.
This chart gives you a peek at the most common options. Propofol is a really popular one. It helps you fall asleep quickly and wake up feeling refreshed. Another great method is a combination of a sedative to help you relax and a pain reliever. Your medical team will figure out what's absolutely best for you. I want to be super clear about this. Your safety is our absolute #1 priority. From the second the sedation starts until you're wide awake, we are monitoring you continuously. We're watching your heart rate, your blood pressure, your oxygen levels, the whole shebang.
Okay, we're on the home stretch. Let's quickly go over what happens after the procedure is all finished.
You'll be wheeled into a dedicated recovery area, and our fantastic nursing staff will keep a close eye on you as the sedation just gently wears off. Honestly, most people wake up feeling pretty good, just a little sleepy.
We have a strict safety checklist we go through before you can head home. You'll need to be awake,
Your vital signs have to be stable, and you need to understand the instructions we give you. And listen, this one is a really big deal. It is absolutely non-negotiable. You must have a responsible adult there to drive you home. You cannot drive for the rest of the day.
So, before you leave, your doctor's going to come chat with you about what they saw. But there is one absolutely critical question you should make sure you ask. This is how you take charge of your long-term health.
This is it. This is the question. Was my prep adequate? And when do I need to come back? It's so simple, but so powerful. It confirms you had a high-quality exam, and, most importantly, it clarifies exactly what your personal follow-up plan is. It's the perfect way to close the loop and feel empowered about your health.